Thank you, Chair. And Sir Simon, may I also say my huge thanks to all of the NHS and social care staff over the past year who've done a tremendous job. My questions really come from the perspective of digital and virtual and technology. And I want to start off just by asking whether you feel the CQC can fulfil a role over the coming years in terms of looking at regulation around the use of technology within the NHS, and if it does already even.
Well, that's actually quite a profound question, because we're clearly seeing a big transition in the way a lot of care is being provided. We saw that with the move towards online and telephone-based appointments to supplement face-to-face over the course of the last year. Interestingly, not just in this country, but around the world. That's the effect that COVID has had on the provision of health services. This question was already in view as a result of some of the changed GP services that were beginning to occur around the country, and CQC was having to decide what its regulatory stance was going to be there. So digital medicine, digital health is obviously going to be a bigger part of what the healthcare looks like in the future. So yes, CQC clearly need to think that question through. That's not to say, however, that a regulated approach to trying to drive change is going to be what's actually going to be the sort of fuel in the tank that's going to bring about more modern forms of healthcare. It's not going to be driven by the CQC. It's going to be driven by what patients and clinicians can see makes sense.
Thank you. And just on that point, so I know in my local trust, the West Herts Hospital Trust, they've done a fabulous job of creating virtual wards during COVID and have helped many patients in the work that they've done by enabling them to be at home but still be monitored and be safe. And I believe even an app was used to help sort of take certain readings throughout the day to check in on them. What's the plans for expanding that sort of virtual ward and the use of digital in enabling the patient experience really to be improved over the coming months and years? If I could come to you, Sir Simon, but I saw Amanda's nodding her head as well, if I could come to her afterwards as well.
Yeah, well, look, Dean, you're quite right. And in fact, I've been to Watford Hospital to see the work that has been led there. They are one of the early adopters of that home-based monitoring for COVID patients. And in fact, the clinicians who've driven that change there are now helping drive that nationally across the country. So a fantastic example of innovation at Watford. And we are going to see much more of that in other areas, such as monitoring of heart conditions at home. And so our NHS digital unit is, over the course of the next year, going to be taking the example of COVID monitoring and deploying that into cardiovascular monitoring. And the same is true for a number of other conditions as well.
Amanda, would you like to add in on that as well?
Thank you. So I would just agree entirely with your point on this. There is huge clinical enthusiasm about going further. We're thinking about things like virtual wards and home monitoring. And it is, for me, another fantastic example actually about why integration can be so powerful, because this is really bringing together primary care and their expertise, the experts that we've got in secondary care around specific conditions, the patients themselves being much more able to be in control of their own care. And of course, that digital wraparound is the thing that enables it. And certainly where we've had some really good conversations with the CQC already is really about how they then bring that really invaluable patient safety and patient experience lens to this, and really help us make sure that we've got the governance in place to do this well across the whole country.
Fantastic, thank you. And so Simon, if I could just stretch that a little bit further, one of the things I've had very fortunate time to see firsthand is the role of volunteering within the NHS. And it seems to be over the past year that the ability to cut red tape, so people like St John Ambulance can help on wards, through to the ability to mobilise volunteers on the ground. So even just identifying where there's gaps in volunteers in terms of time and even helping on wards. Is that something that you anticipate will increase over the coming years, both the technology to support volunteering, but also a drive to increase volunteers themselves?
Yes, I think so, because as you rightly say, Dean, we've seen fantastic examples of that over the course of the last year, both in terms of the national volunteer response, but also local communities mobilising as well. And the current dramatic example of that is the NHS COVID vaccination programme. If you've been to any of your local vaccination services or centres, you will have seen that, as well as the brilliant work that GPs and nurses and other NHS staff are doing, the force multiplier are the volunteers, and this is a huge community mobilisation across the country, and that speaks to the fact that part of the success with uptake here is that this is not just a medical exercise. This is also reaching into communities with community leaders and engaging people, whether that's in mosques or sports halls or rugby clubs, or today, I'm pleased to say, Westminster Abbey, where patients will now be being vaccinated in Poets' Corner.
And just related to that, thank you, on the vaccination volunteers, I've been fortunate to volunteer as a vaccination volunteer myself, and seen actually the huge amount of operational effort that goes in behind the scenes. I don't think it's quite realised how much goes on to make sure that the whole process, from the length of the queues when there needs to be queues, through to the process post-vaccination, with everyone from St John Ambulance again being involved in that. Just related to that, I proposed in a report last year with some colleagues the idea of effectively a NHS cadet scheme to encourage more young people to volunteer at local hospitals. Is that something you think could be explored in the future?
Yes, I think it could be. I think the use of the word cadet has certain resonances that we have to be thoughtful about, because there have been nursing cadet programmes. The Royal College of Nursing, the Prince of Wales and others have been involved in some of those kind of discussions in the past. But the idea behind the idea, I think, is absolutely right.
Thank you. I'll pass back to you, Chair. Thank you very much.
Thank you very much. Neil Hanvey had some follow-up questions.